let's reverse this. Let's do fibroid first, because fibroid is straightforward. Now, everybody that has a uterus will end up having fibroid. Most of the time, the fibroids will not bother anybody. Sometimes fibroid bothers somebody. Fibroid itself, they just growth, abnormal growth in the uterus. In the Most of the time, it is inside the muscular layer of the uterus. But now we know that there are fibroids in almost everywhere in the uterus. It can be outside, it can be inside, it can be in the atrium, it can be hanging, it can be. It's just aggregate muscular stuff inside there. Now, does it affect women? Not all the time. Sometimes it can obstruct the tubes, thereby it may prevent conception. So it can be a cause of infertility if it happens like that. Sometimes it can actually obstruct implanting sites. So sometimes it can obstruct the normal delivery of a baby. So the baby will not be able to go through normal vaginal delivery. The baby goes through cesarean. It can be that. Fibroids tend to grow until they can outgrow the uterine vessels, and then they decay. They begin to degenerate. This is one of the complications. So they can have fibroid degenerations. It can be very painful. It can cause a bleeding. So if a woman, one of the things that women, even if you don't know that they have fibroids, they come to the hospital with the concept that they have a lot of menstrual bleeding, more than what they were used to before.
Heavy flow.
Yes, the flow is heavier than what they were used to before. So you just go and scan them.
So that's like a symptom.
Yes, so that's one of the symptoms. So usually we say that the symptomatic fibroid. Now, if a fibroid is symptomatic, then you tend to remove the fibroid. Usually, if a fibroid is non-symptomatic, you don't worry yourself too much unless the person insists that they want the fibroid removed, in which case then you just remove it. Why do we not want to remove all the fibroids? The reason is that sometimes if a fibroid is somewhere, it prevents other fibroids from growing. If you remove that fibroid, then the other smaller fibroids that you did not see when you were removing that one fibroid, they will then start to grow because there is no pressure effect on them. And then they just grow, and then they grow, and then they grow. And then in a year, 2 years down the line, fibroid is present again. So usually, as doctors, if you want to remove people's fibroid, it's better you tell them ab initio that we will remove the fibroid, though it does not guarantee that 2 years down the line there will be no fibroid. The best management for fibroid is to remove the uterus. So if a woman had completed her family, that means she's had all the kids that she wants to have, and she has now fibroid and is symptomatic, we just say, don't worry, because without the uterus, then there can be no fibroid.
Okay.
So that solves that problem.
Yeah, I saw on in the age of social media, doctors will start into social media as well to debunk some of this information. So one of these popular doctors, I won't mention his name, so he put up a post of I think he just finished a procedure, the line job, some things, and he said that the fibroid removed from somebody was over 20 or thereabouts.
So it can be as 100 sometimes.
Yes.
It can be just like that. Yes.
So that's not misinformation.
It's not a misinformation. They can remove a lot of the fibroids that sometimes they can be as small.
That was like the biggest, like
he has removed. That's him that he has removed. Sometimes it can be as small as
So it's not very small.
Then some can be as big. Some can be as big as my head. Sometimes. So really, it's not about. But they are in different shapes and sizes. If they do not cause any symptom, pain, heavy bleeding to the extent that the woman begins to feel dizzy, the woman will have anemia and all that, we don't want to worry unless we specifically say, okay, this fibroid is actually obstructing the path that the egg will come out of. So blocks the tube so that we know that okay, this woman will not get pregnant without removing the fibroid. So we go and remove that fibroid so that the woman can get pregnant. Fibroid can coexist with pregnancy.
Wow.
So you don't remove fibroid because of pregnancy. The baby will push the fibroids back because the baby grows faster than the fibroid. So really, it's not a competition. The baby wins every time of the day. The only time that the fibroid can have any issue is that if the fibroid is below the baby. If the fibroid is below the baby and then the baby must pass through the fibroid to come out, then you remove the baby through other means. That's a foregone conclusion. So as I said, you remove and then usually we do not remove fibroids when we remove babies. So if you do a cesarean, because if you do a cesarean and you remove fibroid and the baby, the vessels are big because of the baby. If you remove the fibroid at that time, it can slip. And so you leave the baby, you take your baby, leave the fibroid alone, and then when the thing collapses to normal size, you can then go back and then remove the fibroid if you really want to remove the fibroid. It is very rare that fibroid will affect conception, pregnancy, and baby carrying capacity. Is rare. Not that it doesn't happen, but it's rare. There might be other debilitating factors that will be inside, but it's not that. Every time you have a fibroid, then and the curative decision or curative treatment for a fibroid is mammectomy. You remove the fibroid or you remove the uterus. There is a removal there. All the drugs that they bandy about town, saying that this drug will dissolve the fibroid or that drug will dissolve the fibroid or this drug will it doesn't it's not scientific. It doesn't work. It is just a scam usually, and that's what people do. They just come around and they scam people. I don't know why people get their kicks from doing something crazy like that. You just come and then you take somebody that you know is suffering from something, and then you now prey on that suffering. I don't think it works like that. I don't think it should work like that. So that's why we're putting this on the out to the people. Surgery is the treatment for fibroid. For now, there is no known drug that if you take will make your fibroid to shrink. On their own, sometimes a fibroid can go through degeneration. They call fibroid degeneration. If you go through a degeneration, they have outgrown their vessels, and then the fibroids can start to shrink. However, it is not because of the drugs that you are taking. It is just a natural progression of the fibroid, especially if they get too big. If a fibroid is not bothering people, we don't bother the fibroid. Every woman with a uterus has a right to a fibroid. Really, I mean, just like that. If you have your skin, there will be pimples sometimes on your skin. There's nothing that you can do about that. I mean, you sort it out, you move on. That's exactly how it is with fibroid. That's what it is for uterus. The only solution is remove the uterus. If a woman has completed, there is no shame in removing uteruses if you've completed your pregnancy. If you've completed your family, do not be afraid of removing your uterus. Reason being that, I don't know, I don't know why a lot of people are very afraid of it. It doesn't make you less a woman since you've used it. It's an organ that has to be used for a particular period of time, and once it's done, it's finished. It is women who have not had their that we tend to say they need uteruses. They can then say they have to go to IVF if they get old, so that they can get pregnant and have a baby, and that's that about that. So that's all there is to it about fibroid in brief.
Okay, so let's move on to
Hypertension and pregnancy. Now, there is hypertension, then there is pregnancy. You can be hypertensive before getting pregnant, and then you carry it into the pregnancy. Then we will know. Usually, This is why we ask women to come to hospitals before they get pregnant so that they can have your baseline. The definition of hypertension in pregnancy is not necessarily that you are actually in the hypertensive range of blood pressure. You can be normal blood pressure and already you are in the hypertension in pregnancy category. So a woman needs to come to hospital all the time, do normal checkups, so that when you get pregnant and you go to your hospital and say you want to have a card, and then they do your blood pressure, then they follow you up with your blood pressure, they can know that, oh, this woman has crossed the threshold. It's possible that this woman is having hypertension in pregnancy. Now, that's the foundation. It is usually it has been the placenta bed has been implicated in all this stuff. How is the scientists that will be discussing that? But it happens. It is very bad if it's not managed. Hypertension in pregnancy and a woman that now goes to have what they call proteinuria, that's when proteins are present in her urine, is preeclampsia, and that is a first sign of something very evil called eclampsia. And the reason why we're talking about it is actually because of the eclampsia. And the eclampsia, it happens to a woman. There are no happy endings when a woman has had an eclampsia. Baby might die, mother might die, both might die. Mother might be alive and baby will be alive, and the mother is in coma. She cannot be woken up again. She has to be ventilated. Mother might have lost her kidney function. Mother might have, it will do something. It will damage something. That's eclampsia. It tends to want to damage something. It's not there to play. So the best thing for the eclampsia is prevent it from hypertension. If you are pregnant, go to hospitals, do your blood pressure, check your urine, let them follow you up properly. Now, when I say go to hospitals, I mean hospitals where there are doctors. If you're going to hospital for antenatal, please ask the hospital that you are going to, do they have doctors on call? So that when I come in at 12:30 in the morning, I have a doctor that will attend to me. Because you see, there's this bad concept. The professional nurses, most of the nurses in Nigeria now are heading out of the country. You see, everybody is talking about doctors, Japa, Dr. Japa. Doctors are not the problem of the Japa. Professional nurses are Japaing heavy. They're going to UK. So that means that government gets the pick of what is left. The ones that are left or that are not picked will be picked by the big private hospitals. Now, the small private hospitals will not be able to compete in price, in fee,
negotiation and everything.
So they then tend to make do
With the little that they have.
with what the people, the untrained or the semi-trained, what I call the auxiliaries.
Yes.
So when they use the auxiliaries, they are cheaper,
In fact, some of them, even some of the so-called, they go through like an apprenticeship.
Yes.
They're learning.
yes, they
to
learn
be
the
plumber.
thing. Yes, they
And
do
they
that.
do freedom.
They do freedom for them, and so those ones are.
I'm sure you've had to deal with some of them in your.
And somebody had brought his son to me. His son, so like 4 years ago, he brought his son
To come and
me.
learn.
Yes, that can I make him a doctor? He will come. How many years will it take me to make the boy a doctor?
Like an apprenticeship.
Yeah, that he will come every day. I said, okay.
I can already guess your answer.
I know. I just asked the boy, where are you secondary school wise? Have you done your WAEC? Okay, you come. Let's talk. I will teach you how to go through your WAEC and JAM.
Yes.
You write WAEC, you write JAM. I will send you to the professors that taught me. They are alive. They will do a better job of teaching you than I would do. So you will go there.
to learn on the job.
You cannot learn. You cannot learn on the job. That's why UCH exists. That's why UCH is the teaching hospital. That's why you teach.
Yes.
UCH. That's why LUT exists. That's why LASUT.
Yeah.
That's why OUTH and
Yes.
Those ones are where designated centers. That's why those ones too, they have their own school of nursing.
Mm-hmm.
You get? Now, what we then have is government is at fault. Primarily, yes, government now going to establish all the school of health technology, school of health sciences, school of this. They allowed private investors to put us this one.
Well, that's why they ordain this lab scientists and
Why do I want you to? You see, 10 lab scientists, how many labs are outside? How many labs are? Where do you put them? Then you create a teaching arena that we are making, okay, we are going to be graduating XYZ. Have you provided opportunities of employment for XYZ? Because once you graduate them, nature abhors vacuum. They will find something to do. And if you don't give them cogent work, they will enter the next field that looks like what they've been taught, and they will not work well there. So ask the hospitals that you are going. Most hospitals, small hospitals, private hospitals, have nurses. They don't have nurses. If they have nurses in the morning. They don't have nurses in the evening. That's the bad part. And bad things happen in the evening. And then your hospital is there. The nurse that is there is actually a trained health technologist who has no knowledge about preeclampsia, and this person has preeclampsia, and they will watch the person, and the person will fit. They will not even know. I've been called to a hospital where the nurse did not know. She's not a nurse, and then because she's not a nurse, she reported to the doctor who is at home that the patient has abdominal pain, and the doctor said treat for gastroenteritis. And meanwhile, one of the cardinal ill signs, ill symptoms of preeclampsia going to eclampsia, the abdominal pain. And she said it, but she didn't do the blood pressure when the woman came. Admission blood pressure, she did not do. When I got there, I said, do the blood pressure for the woman. The woman was not talking to me. I said, she's not talking to me. I said, do the blood pressure for this woman. She did the blood pressure for the woman. It was 200, 120 something. I said, this woman has already had a seizure. She said, no, she don't have a seizure. I said, this woman has already had a seizure. Why are you giving her gastroenteritis? Why are you putting that woman? We lost her. We lost the baby on that day. Finished. So it speaks to that. And this, if I mention the name of the doctor, everybody will say, ha.
a known doctor.
He's a known doctor. It's a senior consultant.
Wow.
And so senior consultants to employ choose and non-nurses in their services. So government,
Because of cost?
yes, it's cost. It's just
cheaper
cost.
to have.
It's cheaper to have them. They are those ones they are not going to be. It's all this agitation in health service, health sector. They need to increase their salary. Hospitals that hospitals, big hospitals, use these non-nurses choose as bulk staffs.
Yes.
So they will put maybe 2 nurses on the ward.
Yeah.
They put like 8 of those women.
2 male nurses.
2 male nurses are there. Then they put like 8 of those women. And then what goes on? And then government is not interested in looking at the whole composite structure. Government comes to look at the nurse. So once they see the nurse and then they see the doctor, they go away. They forget that.
No, maybe because even the hospital owners to know how to maneuver their way. Maybe they hear about the inspectors coming. They just that's it.
But inspectors should not come.
Because most of these big hospital owners too are stakeholders in the health sector. They have friends in. So when we say government at the end of the doctor,
it goes
the government.
It goes around, but somebody that is saddled. When somebody is saddled with the responsibility of enforcement of standards. I will, as much as possible, want to water down standard. That's what I do. I will want to water down. Everybody wants. As we are sitting down here now, it's compulsory. Somebody is saddled with responsibility of making sure that you come to work every day.
Yeah.
If that person agrees with you that you don't have to come to work every day, in fact, that I don't want to talk about. Maybe you have a laptop. Let's put this software on your laptop. So at 12 o'clock, when you're supposed to produce this program, don't get on your laptop from your home and start talking. It will be as if you are in the studio. Then you will not come to, because nobody is coming from your headquarters to come and check. Since you have had, but that person is the person that has failed the system. So the people that have been appointed to enforce standards across all, not even Oyo State alone. Lagos State has their own problem. Ogun State is the headquarters of quackery in the western states now. They are the headquarters of quackery. Ota zone, Ijebu zone, those are the headquarters of the thing in that area. This problem, women get pregnant. If you cannot find anywhere to go to primary healthcare centers. You see, the nurses in primary healthcare centers are usually senior midwives, and they put them there. And those nurses understand. If they see what they don't know how to treat, they know to refer very promptly. Very promptly. I am not against government establishing health institutes to help people, because everybody now come about that and say that these are elitist views now, because they have become doctors. They are not going to allow people to pursue. Yeah, I'm not interested in you not pursuing your dream. What I'm interested in is that when you're pursuing your dream, do not kill the pregnant woman who comes to you. So government will enforce when the referral. It is statutory. You must write it down. What is the standard operating procedure? Once you get to this point, this is what you must do. Every year, the Society of Gynecologists and Obstetrics in Nigeria, they meet and they review their operating procedure on a lot of obstetrics issues, and they bring policies out. And even we, as senior doctors, we read the outcome, we follow the outcome, because they are the super specialists. They are the ones that are seeing the end result of whatever nonsense that we might have done to these people. So if you go to UCH now, you will still see in UCH, just go on Friday. Go on Friday evening. By the time you go on Friday evening, that's everything that is happening in Ibadan from Monday till Thursday till Friday. It's on Friday evening that they will disgorge them from different hospitals. They go to UCH. By the time you're getting to UCH, those who have seizure will have seizure. Those who not have will die. Those who and then UCH, the patient we need to put in an ICU admission. You don't have money to pay for ICU admission. You've wasted a lot of money in your there. And will have referred them early to UCH. They will have done the surgery on Monday. There will be no need for ICU admission. Mother and daughter and mother and son will have gone home easy, but no, you insist, and government should begin to go after those kind of people who make those kind of practices, because they actually contribute. There are some things now with the level of knowledge that women should not suffer from. Hypertension in pregnancy is one of them. We should be talking about eclampsia as a historical disease, because all the things that gets to eclampsia we already know. So we can, what's the purpose of going for antenatal? We always encourage women, go to antenatal once you have missed your period. Go and register. There are some women, and this happens to women who had had kids before. So maybe you had your first baby, your second baby, then women never attends antenatal until they get like 7 months, 8 months. And then at the end of the day, whatever is going to be happening has happened by the 7th to 8th month. Sometimes the women come in at 9th month to register for antenatal, and then they come in at 9th month, they already have preeclampsia in situ. So and then they come in, and then you now have to be back. It's something that you should have with all pleasure, with all ease, sorted out from the 7th month. You will now begin to fight towards the end, because the women will say, what are we going to do in the hospital? They will waste our time. Yes, hospital, especially in UCH, they waste your time. They will send you to go and be doing the investigation. Yes, we appeal to the runners, the management of UCH, to aid some of these things so that the patient can have some positive experience. Yeah, but patients, one of the reasons why they call you patient is that you must be patient. That's one of the primary reasons why they call you patient. You must be patient. So please be patient when you get to the hospitals. Let the doctors take time, examine, do the counseling, do the investigation review before they send you. Do not be in a hurry when you come to the hospital, because if you are in a hurry, it is your life that they are talking about. You do not tell your mechanic. If you take your car to your mechanic and they are fixing your engine, You do not hurry them to say, oh, yeah, do it, do it. No, you will be telling them, please do it very well, because you know that when you are on the main road, express road, going at 110 kilometers per hour, you do not wish that one of your tires should remove. So I do not then understand why your life and the doctor, you are talking, and then you are telling the doctor, let's do quickly, I want to go somewhere. Where? Only the living goes somewhere. So please, be patient when you get to the hospital. Hospitals, please let us as much as possible, make all these interactions with patients a positive experience for the patient. Please, government, please, standards of care should be enforced. It is not ideal in 2023 that eclampsia and pre-eclampsia is still something that is counted as a source of mortality for our pregnant people. It's bad.
Okay, since we started with an exciting news again.
Nigeria is leading.
So, yeah. Us Nigeria Harley. Well, thank you, doctor. We need to quickly go and watch the remaining few minutes of the game.
Yes, sir.
So thank you. We'll be back next Thursday on Doctor in the House. Bye-bye.